Did you know that your doctor might give you pills that contain someone else's poop to help make you healthy? Poop pills to make you healthy. That's what today's video is about. Hi, I'm Dr. B. I'm a medical doctor and I like to make educational videos about topics I find interesting. Poop pills are a real thing. These are medical capsules that contain frozen human feces, harvested from one person, that are swallowed as a medicine to treat underlying disease in a different person. True story. These are known as fecal transplants, and the medical term for this is fecal microbiota transplants, or FMTs. In today's videos, I'm going to teach you what is a FMT, why do we do them, how are they delivered to a patient, and stay until the end to learn the fascinating potential use of poop pills for healthcare in the future. FMTs are quite sophisticated today, but their origin in history not so much. The first records of fecal transplants are from China in the 4th century, where there's records of human feces called yellow soup given to patients to drink who had severe diarrhea. The process is a little bit different today, but even in modern medicine, fecal transplants, or FMTs, are the purposeful transfer of healthy human feces from one individual to the insides of a different person, again on purpose, with the goal of transferring the bacteria in the feces from the healthy person so they start growing inside the sick person's large intestine or colon. And the goal is to repopulate the sick colon with a new population of healthy bacteria from the poop donor. Exactly the opposite of what your mom intended when she said, wash your hands after using the bathroom. So why does this work and why is it necessary? Well, the colon is home to trillions of microorganisms, specifically bacteria. These bacteria are numerous and diverse in a healthy intestine. And by diverse, I mean greater than 1,000 different species, not unlike the diversity seen in a rainforest. This is known as the gut microbiome. And in everyday life, these trillions of bacteria reproduce, they live, they die, they carry out their life cycle, and they produce substances that are absorbed and are vital to normal bodily function. We don't think about the bacteria, and we're not really aware of them, but every day the bacteria fiercely compete with one another for living space and food in your colon. And because of this intense competition, no single group of bacteria can take over and become a dominant player in the intestine. Medications can change all of this, especially repeated antibiotic use. Imagine clear-cutting a forest, except in the colon. Antibiotics given for infections like cuts or sinus infections or pneumonia can treat the skin or lung infection, but can devastate the normal population of bacteria, just like deforestation in the Amazon rainforest. When this happens, there is no longer competition in the colon between different species of bacteria, and just a few bad types of bacteria survive, and they thrive. And these bacteria multiply and take over the whole colon. This leads to a common colon condition known as Clostridium difficile colitis, or C. difficile, named after the bacteria, the bad bacteria that takes over the whole colon. The result is an awful disease with constant, untreatable pain, unrelenting diarrhea, weight loss, and frequent death. In the United States, this disease affects 500,000 people a year, and up to 30,000 people die. In the past, this has been largely untreatable. Fecal transplants have changed all this and can be a miraculous treatment for C. difficile colitis with a 90% success rate. So how are fecal transplants delivered to treat this type of disease? Well, poop pills are just one of several ways to administer fecal transplants. The delivery methods really are divided into two. One is from above and one is from below. Now, from above, the fecal transplants can be put in an endoscope or a plastic scoop. The scope is known as an EGD, or an esophagogastroduodenoscopy. This is a medical scope that's metal, flexible, and has a light on it that they steer through your mouth, down into your stomach and into your intestine. Once there, syringes full of liquid stool or feces are injected. You can also take a plastic tube and use X-ray guidance to go through the nose and down into the stomach or deeper into the small bowel. Again, to do the transplant, syringes of liquid feces are injected through the tube into your stomach or into your small intestine. Fecal transplants from below are similar, but the other direction. The scope is similar. It's a flexible medical scope and it's known as a colonoscopy, the same device that's used to screen for cancer. The light in the scope is used to steer through the 5 or 8 feet of the colon, and then syringes of liquid stool are injected to coat the entire colon. After the fecal transplant, the patient will wait a few days to see if the new bacteria take up residence and make the colon their home. Symptoms can start to improve as soon as 3 to 4 days after a transplant. As you might imagine, compared to having a medical scope placed through your mouth or through the other end, taking a pill is much more desirable and better accepted by most patients. This is a newer way to deliver fecal transplants, but there is increasing evidence that pills are not only safer, because you don't have to have a scope, but may be just as effective as the other more invasive methods. Now, an important point, when they do the fecal transplant, especially from above, whether it's by pill, the scope, or the plastic tube, you have to get the material deep enough so the person doesn't cough the stuff up into their mouth and it spills over into the lungs. You can imagine having that material into the lungs can cause very serious infections. The colon is made to have stool in it, but the lungs are not. The best known indication for fecal transplants is bad colitis, that is infection with that bad bacterial C. difficile. And remember, 90% success rate in this can be life-saving. But there are a number of fascinating investigations that are being researched right now with fecal transplants to treat other diseases. These include common diseases like ulcerative colitis, Crohn's disease, and inflammatory bowel disease in general. Fecal transplants are being explored in type 2 diabetes, and specifically in treating obesity. There is also fascinating work being done in Parkinson's, autism, and even multiple sclerosis. All of these are active areas of research using fecal microbiota transplants or fecal transplants. That's a little bit about poop pills, also known as FMTs. Remember, these are educational videos, not medical advice. Do not try this at home. FMTs should only be performed by trained professionals. Realize that there is a very strict process to screen those individuals that supply stool for FMTs. There's a strict process to prepare the stool before it's administered, and ingesting feces from another person without the strict process can cause serious infection and death. Thanks for watching. If you found this interesting, try these additional videos on the gut-brain axis or the broccoli-brain axis. And please don't forget to hit subscribe.